how can you leave a legacy during your lifetime?
Really focus on making a patient's life better.
A culture of always doing the right thing, always taking care of the patient.
It's in the most advanced way possible.
Very serious about our science.
The best program in the nation.
Helping to guide the education of plastic surgeons nationwide.
The team at Michigan is a really critical component of the field of plastic surgery.
We have a lot of scientists who are working out some of the most complex problems.
Scar rehabilitation.
Nerve injury, nerve regeneration.
Plastic surgery is quite diverse.
We have a whole array of expertise.
Plastic surgery has always been in the forefront of transplantation. The first organ transplant ever done was done by a plastic surgeon.
Cosmetic surgery is actually just a very small part of what plastic surgeons do.
We are anatomic experts in the whole body, not just one area.
We do everything here, head to toe.
From the top of the head to the bottom of the feet.
Here's an example.
We have at this moment very cool and sophisticated prosthetic arms. The problem is that nerve signals they're not very strong if we just record from the nerve. So you can get a computer to move this hand and do all these really crazy individual finger movements, but the patient can't actually move them because there's no interface connection. So what ends up happening is that amputees don't use these prosthetics and they abandon them basically for the hook, typical hook prosthetic, which has been in since the Civil War.
Yeah, it's interesting. I think Dr. Kuzan would always say to pick a problem that makes you angry and go after that.
We figured out a way to connect with people's peripheral nerves to allow their nerves to control a prosthetic device.
And what we do is that amplifies the neural signal.
Because it allows us then to convert nerve signals, which are tiny microvolt level signals, to huge muscle signals, which are 1,000 times bigger.
Which can then communicate wirelessly with a prosthetic hand. And we're the first people in the world to actually get individual finger movement from nerves. This is groundbreaking. This is going to be the stuff that's going to make the news. We know we're going to make an amputee play the piano with his prosthetic hand. We know it. It's just a matter of time.
The research part of this institution is a big part of the culture of this institution.
Here, everything is translational. Everything translates from the bench to the patient.
As a doctor, you get to meet these patients and you see the real struggle that they deal with, and you can't help but then want to go back down to the lab and start pushing things along to find out what can we do to make that better. As a burn surgeon, one of the things that bothered me was there's no objective way to assess how deep a burn is. And so I've been working the last 3 years with outstanding people in my laboratory to develop a camera that could actually distinguish whether tissues are viable or not based on tissue moisture.
It takes a commitment to allow scientists to find the next miracle that's going to make a difference in the lives of millions of people.
We are constantly thinking of ways to make the care of patients better.
Not only in bioengineering, but also tissue engineering.
Heterotopic ossification.
Lower extremity trauma.
Looking for new and better ways to control and prevent pain.
25 years ago, we discovered the clinical utility of fat grafting, and now it's actually become commonplace.
Our end goal is to get people back to where they can just live a normal life.
We're interested in people who want to make a difference, who want to change the field of plastic surgery.
Plastic surgery is one of the most competitive residencies to get into.
And it astounds all of us every year when we see the accomplishments of these young people.
And these residents aren't just any residents, they're some of the best residents in the country.
Literally, the cream of the crop.
And what that means is I can teach them, and if they're really smart, which they are here, they can teach me. But not only teach me, challenge me.
The moment you step into Michigan, you realize that you're surrounded by everyone who is actually the best.
Every week, every minute, you learn of a new technique, something that's being figured out.
You know, we're kind of a hub for complex cases.
Walk down the hall from our resident office and be able to interact with a lot of the pioneers and leaders in the field.
Everyone that you meet is the expert in that field.
We cover so many different areas during the training of our residents.
From craniofacial surgery,
burn surgery,
hand surgery,
cosmetic surgery,
microvascular free tissue transfers for complex reconstruction.
cleft flip.
And it blows you away.
I think that the operative experience we get here, the clinical didactic experience we get here, the research opportunities we get here kind of all coalesce. And there was no place that had, checked all the boxes like Michigan did.
When we go to the meetings,
When you go to different places for meetings,
is something that's very special at the University of Michigan.
there's this unspoken understanding that Michigan is leading the way in both patient care as well as advancing the field.
That teamwork, that sense of collaboration amongst the team, it's something that other programs notice all the time. It's something that other faculty members mention all the time about the University of Michigan, and something I'm very proud of.
We aim to be leaders and the best.
The name Michigan medicine resonates around the world.
I think Sir Isaac Newton was the one that said that we stand on the shoulders of giants. Where we are and what we do and the success that we have is because of the people that came before us.